Hi, I'm Dr. Alan Goodwin. I'm a psychologist, and I thought I'd take a few minutes just to talk about psychotherapy for helping you cope with fears connected to medical procedures or dental procedures. Um, Anxiety, is fear. It's a fear that something is going to happen that will take away my happiness. And the key in coping with anxiety is recognizing that really the fear is that something is going to happen that'll take away my happiness because I won't be able to cope with it. So, effective psychotherapy is all about helping the client to learn new coping strategies that'll be effective for them. And remember, if you look at the cognitive behavioral therapy video, you'll see that there's a model that we use in therapy for in goal-directed therapy for anxiety, which is the one that I described in the cognitive behavioral therapy video, and that is that the way that we think and the way that we feel and the way that we behave are all causing each other all the time. Okay, so if we look at what you're fearing, we'll have an opportunity to understand better what thoughts are underlying those fears. And that's how we would work in the therapy. And we'd also talk about healthy behaviors that will help you to think more constructively and to tamp down the fears. People can feel fearful about pain that they expect. They may fear um, having an elective procedure because they may regret it more if it doesn't turn out the way they wanted it to, especially with cosmetic procedures that are elective. Some people can really beat themselves up for deciding to do it in the face of the reality that you can never know how it's going to turn out with a cosmetic procedure. So you really have to come to some acceptance of that. And a lot of people have a lot of trouble doing that for different reasons. So this can be true of bariatric procedures. It can be true of facial cosmetic procedures, body contouring procedures. Also non-surgical procedures like Botox or fillers or anything else really that would be done in an office, even though there isn't a, a, a surgical procedure happening. People can still fear the pain, the recovery process, the fear that it won't turn out the way that they want it to, the fear that people will know that they had the procedure, and they might struggle with some feelings of shame or embarrassment about that, especially men. And all of this can be true whether it's an elective procedure or not. Even medically necessary procedures can stir up a lot of fear, especially because of the fear of the physical pain, the recovery process. There's usually some discomfort, um, but also the uncertainty, the risks that you take. There's some risk in any surgical procedure, and so what we also do is we work on the cognitive methods that you can use to keep yourself grounded. Really, we remember that the cognitive part of the work in psychotherapy is not about positive thinking. It's about accurate thinking. So we want to be looking at the reality and accepting it and honoring the decision that we've made to pursue this or that procedure. Okay, so I hope that gives you an idea of how psychotherapy can help. A lot of people just turn to medication for discomfort, whether it's physical pain or it's emotional discomfort. Medication can help, but really a more effective approach for coping with life's stressors is effective psychotherapy. And I hope this video helped you understand how you could use that in preparing for a medical or a dental procedure that is really scaring you. Okay, thanks for listening.